Good afternoon, and today I have a pleasure of interviewing my professional and personal friend, Dr. Mohamed, who joined us from Canada, and Emilia del Pino. They both speech and language pathologists who also learn, embrace, and practice myofunctional therapy. Good afternoon.
Good afternoon.
Good
Thanks for
afternoon.
having us.
So in this conversation, we're gonna learn why speech and language pathologists become increasingly involved in airway, mouth breathing, sleep disorder breathing, tongue ties, swallowing disorders, and facial development. And for me personally, I don't consider speech and language pathology so far in the field from myofunctional therapy. It's kind of in the same area, and I think it's really advanced, but my guests also follow the same idea. So in this episode, I'm gonna interview Dr. Mohamed and Emilia about evolution of speech and language pathology beyond just speech production and articulation. And we discuss the growing importance of oral myofunctional therapy and airway-focused healthcare in disciplinary collaboration in pediatric development. So tongue posture, swallowing pattern, orthodontics, and sleep. And I think this conversation is going to be very interesting for dentists, orthodontists, hygienists, physicians, therapists, patients, or someone who is interested in sleep and breathing. And we're going to talk about how function influences growth, development, and overall health. So my first part of the story, I want to talk a little bit about Dr. Mohamed and Emilia. So Dr. Mohamed, he originally from Sudan. And I have, with my previous life in Soviet Union, we have a very good ties with this particular country. We had a lot of Sudanese students, and I actually was very, close. We had a personal family friend from that country. So I was so happy to learn that you are from Sudan. But I'm impressed with your pathways, going to PhD program from Sudan to San Francisco, California, to to learn about psychology and how it's all turned into speech and language pathology and eventually to myofunctional therapy. But I also know what Emilia studied psychology as well. So it's a lot of psychology in that field. And then she became interested in speech and language pathology and myofunctional therapy after that. So two very educated people, and they part of actually group of 4 people who I interviewed on my channel before as well. And they have a wonderful course coming up in October in Westchester area, and we're going to learn about that in our program. So my first question to you, Dr. Mohamed. For decades, speech and language pathology focused primarily on communication disorders. What changed in our understanding on relationship between speech, swallowing, breathing, facial growth, and sleep? What changed? How come?
Okay. Oh, this is a very broad question and an interesting question. It's a very big. It takes days to answer this question, but I will do my best to narrow it for the sake of this interview. As we know, all in the medical field, that the whole system, the human being, is all connected together. We function as one unit. We have different units in our body, but we function as one unit. So the breathing first is the most important aspects to do anything. So if you have the issues with the swallowing itself, is the most complex act that the human being can do, because it has to be synchronized very well with breathing. Any issues, any difficulty with breathing is going to cause you in choking episodes, in swallowing difficulties. And then you will go on a really bad journey, like of and affecting your quality of life. This is in one side. Is still people can swallow with the tongue thrust and they can survive, but also that will affect their facial growth, affect their overall health, their teeth, their mouth, their even the smell of their breath, the posture, like back pain, lower back pain, and like even calf muscles. It could be affected. Is sleeping at night. People sleep for 8, 9, 10 hours, and still they might not get enough rest because they are not breathing properly. They keep tossing around all night long because they are mouth breathers, because they are looking for air. And then they wake up in the morning, they have headaches, and then they are, like, and they're still sleepy, or even because they're mouth breathers, become hyperventilated.
Yeah, that's a beautiful answer. Emilia, do you want to add anything to, that development of your field and why you, become so passionate about myofunctional therapy?
Well, I think we as SLPs are really looking at dentition, airway, and orthodontic considerations. So when we are having interventions that patients are seeking out our support, we must understand the basic functions of these systems, as Dr. Mohamed said, but we also need to look at patients in a broader lens versus just our separate scopes and speech output, because the vocal quality or the fluency or the stamina of speech and articulation is very much based on diaphragmatic breathing, posture, all of these subsystems. So that's the reason why myofunctional therapy really needs to be a component in a lot of our graduate schools, because it's the foundation for all of these areas of chewing, swallowing, oral rest, posture, and sleep, which we know now the research is coming out more and more regarding how important sleep and breathing is on many, many domains.
That's a beautiful answer. I also did not mention in my introduction about Dr. Mohamed book, but we definitely gonna put the link for your book underneath this interview. What people who interested in the course, they can start with the book and then slowly learn and get ready for the course you're giving in October. So my other question. Many health professionals are looking at the myofunctional therapy just like a tongue exercise. How you can explain the true scope? Why is it such important discipline? And maybe almost every child have to have myofunctional evaluation early on to kind of plant the right habits for development.
Well, I
We can
think
start
now,
with Emilia.
yeah, I think now we as SLPs are really the key providers in prevention healthcare and interdisciplinary airway-centered healthcare. So it is our role and our scope to make sure we are screening early on, even when children are maybe having some difficulties with latching after being born. So we look at, the breastfeeding dyad or the bottle feeding. So we're looking at signs and symptoms that might occur early on, or sometimes even later on when they're being seen for selective eating. These are opportunities to look at the feeding, the suck, breathe, swallow synchrony that Dr. Mohamed spoke about when we are looking at feeding. We can also consider sleep when parents are concerned, and we can do a screening. How is your child sleeping? Are they waking up frequently? Are they tossing and turning? Do they have extended head posture? So some of those pediatric sleep questionnaires, engaging in conversations with parents and also pediatricians at an early age to educate and evaluate and help patients advocate for myofunctional screenings early on. Then as they're getting older in the school system, if we could really bring awareness to school professionals about mouth breathing when they see students mouth breathing, drooling, articulation and fluency difficulties. These are opportunities that they can select a speech screening with a myofunctional component. It is certainly a great question about these cookie cutter programs that are out there on the internet. And I think just like any intervention, we really need to approach the patient with case history questions, asking how their signs and symptoms have evolved, have they gotten worse, and get a really good picture on where they're coming from and some struggles that they've had and things that are going well, and individualize their care based on what we're seeing and what they're reporting with sleep quality, with their diet, the things that they're eating, and chewing and growing the jaw. There are opportunities for chewing, and these are areas that we could make an impact on, giving some suggestions about chewing and healthy diets that are really going to grow the facial musculature, and based on posture and breathing, sleep, feeding, and our observations. After that, we might need to consult with another professional in another domain, whether it's ENT or pulmonology, dentist, or orthodontist. After we have a comprehensive picture of the patient, only then do we sit with them and or their family members to come up with what are some of the goals that we'd like to select for therapy long-term, and then some short-term goals. And those exercises, those tasks that we do are very hierarchical, but it is up to the clinician to really be clinical thinkers and be able to problem solve, because we are not just giving lists of exercises, we are watching their form, how they're functioning, any compensations they may have. All of that is clinical judgment and skill set that then helps us to develop what specific tasks they may be doing in our session and what goes home for carryover and generalization.
That's a beautiful answer. I have a practical question for you, Dr. Mohamed.
Yes.
So, as a speech and language pathologist, or can you explain to me, who see kids or adults, what practical sounds should I check to suspect either speech and language pathology or myofunctional, pathology? In the sense of sound, I always find that very challenging for me, not a native speaker also, but I'm sure there are certain sounds what either I can ask patient to produce, or I can maybe ask them if they have troubles with. So what would be the practical evaluation, like if you're looking through the lens of speech and language pathology?
Thank you. This is also a great question, but I want to go back to the exercises because that will lead to the answer to this question. People has to professionals or practitioners and parents and patients, they have to understand it is not about just the exercises. It is about habituation. Is how to this the goal of these exercises actually to make it a habit, because some patients, they might come back to you and they were able to do all these exercises 100% correct, but not yet a habit. And sometimes you need to make sure that you need an expert myofunctional therapist to work with you. Doing the exercises 100% correct doesn't mean that you achieved your goal. It has to be habituated.
Right. That's a very difficult thing.
Yeah,
To
and that
get
is
to
what.
become part of you, to make it part of you.
Yes.
And daytime as well as nighttime, right? So I always
Yes.
tell
That's very important point.
we can't expect nighttime sleep patterns to change until we do it while we're conscious during the
Yes.
day.
During the
So
day.
it is gradual, and it is, I think that's a great point, Dr. Mohamed. It's also taking time to be conscientious and check in on how we're doing with that carryover,
Yes.
with guidance and different apps that we're using nowadays.
Yeah.
It's a lot easier to be able to do some of that.
Back to the sounds. So the sound that mainly you are going to listen in your clinic, the S sound.
Mm-hmm.
They might have a lateral lisp, frontal lisp, the Z sound that they might have an issue with it, mainly also the R sound. However, the R comes in different forms. If you are French, your R is different from English. If you are R from Russian, if you are Arabic speaker, is different. So the R comes in different forms. Okay, so also as a therapist, you have to be aware of that. So when in Canada we have a lot of French speakers, so there is a little bit like a back sound.
Uh-huh.
So you need also to make sure, is it dialectal,
Mm-hmm.
or is it actually a difficulty or an error with that sound.
Got it.
Okay, some in severe cases you might hear difficulties with the th sounds.
Or
Okay, the sh sound and the j sound, but these sounds you will hear them in more severe cases.
got it.
But in like normal myofunctional disorders, they most of the time they come with the s's, the r's, the z sound. Having said that, there is a lot of people that they have myofunctional disorders, and they are very good in producing all these sounds.
Uh-huh.
However, having said that, I have to make sure that as a therapist, you have to differentiate between acoustically
Uh-huh.
and placement, because acoustically it could be correct.
Right. That's, I think, I want to add, speech and language pathologists
Mhm.
used to do. They try to find a way to do it acoustically.
Yeah,
Correct.
acoustically.
Doesn't matter where the tongue really
Yes,
is.
yes.
Acoustically, it sounds okay.
But placement, then you have an issue there.
Right. I 100%. So it leads me to my next question.
Go
I
ahead.
want to ask you, what's the actually evolution of the field of speech and language pathology now, and what your course can offer to speech and language pathologists to learn about myofunctional therapy, and a lot of myofunctional therapists to learn about speech and language pathologists, because it's just so wonderful what, like, two speech and language pathologists on this side, and then Nicole and Hital on myofunctional therapy side. So people who follow you, usually they're in the same field. So how it can be, yeah, I would say, cross pollination of the field, or evolution of the field to the next stage.
Emilia?
Mhm.
So, in order to answer that question, I will actually give some backstory on how the program and the course was developed. Years ago, Nicole and I took our 28-hour course together, and it was a dental hygienist and an SLP teaching the course. And we found that extremely powerful, the information on understanding dental considerations, airway and orthodontic considerations in treatment planning and assessments. What we found soon after is we began to study together and ask questions, take videos, share questions about patients. and really for me as an SLP to understand a little bit more about how these occlusal concerns, gum disease, all of those factors are important to support proper speech and swallowing and airway. So we became colleagues in collaborating on patient care. That was our first step. The course that we're offering really is assessing and treating patients with a broader scope. So looking at patients with a different lens, or just maybe more of a deeper lens, and being able to have conversations with one another like we'll have in our course on, from our perspective, this is what we are considering, and what do you consider from your perspective, and having this dialogue, which is really the natural dialogue that we promote, and we hope in our community we're promoting, where we really do need support of other practitioners for ourselves for learning, but also for optimal patient care. So, answering the question about where do we see the field going, I feel like SLPs and dental hygienists will continue to work together in more of a collaborative nature and being on teams together where we're serving patients holistically, comprehensively.
I love it. I love that topic. I want Dr. Mohamed to add. Yes.
Yes, and also what interesting is about our course, because it is about, we heavily about anatomy and physiology, because it is all about the anatomy and physiology. You need to really have a good grasp of your understanding of, when they teach you in school, most of us, for example, they teach you about the lateral pterygoid. They teach you about the lateral pterygoid and the insertion, the origin and the function, but nobody is teaching you how to assess the lateral pterygoid.
Right.
And
Very important.
and if you assess the lateral pterygoid and there is a problem there, nobody taught you how to treat it.
Got it. So this
And,
is a little bit deeper area.
yes,
Related to temporomandibular joint disorders. Great.
yes, and this applies to the masseter, to the buccinator, to the risorius muscles, the tongue muscle, the intrinsic, the extrinsic muscles. You need, as a myofunctional therapist, you really need to understand everything about these muscles and how to assess them, not just to know them and the function, but how to assess each one of them. And if there is an issue, what do you need to do about it?
Yeah, that's a beautiful story for the course. So I highly recommend people who want to increase the level of knowledge, to have a better understanding of this area. If you're speech and language pathologist, if you're myofunctional therapist, if you're dental hygienist as well, or if you're a dentist, or maybe even physical therapist, because there are different aspects of those professions. Like, I like how you start our interview talking about what we're not headless horsemen. It's actually all connected, but in the same time. And actually, I never thought about that. You made me think about the fact how complicated swallowing process actually is. Like, I can do multitask in the same time. So we're all multitasking by swallowing and breathing in the same time.
Yes.
It's actually so close to each other, and if it's gonna go if one thing gonna go to the wrong, like if air gonna go, it's not so good, but it's doable. But if the food gonna go into the wrong pipe, that's not doable. So that's a very complicated ballet act, what we're doing 900 times a day.
Yeah.
And to understand all of that. So thank you very much, Dr. Mohamed and Emilia. We're going to put information about the course underneath this interview, and people can get in touch with you and hopefully enjoy that course. And also to read the book of Dr. Mohamed And I really appreciate what you share your expertise with my audience. Thank you.
Thank you so much
Thanks for
for,
having us. It was a pleasure speaking with you.
yeah, thank you. Take care.